child is not a miniature adult. Okay? The structure and the physiology that a child has is very different from a normal adult. So it requires, after 3 years of training in adult surgery, it requires a specialized training of 3 years in pediatric surgery for to do all these surgeries in the small kids. So that's why if a surgery on a kid has to be done, it has to be done by a pediatric surgeon. Yeah, so when we deal with in adult surgeries, we deal directly with the patients, as opposed to when in pediatric surgery, most of our dealing and explaining the complexities are with the parents. And the patients, most of them cannot tell us the complaints because a 6-month-old cannot tell you where his pain is or what his complaints are. So we have to rely on a lot of other skills, soft skills, to get the complaints out from the parents. And there's a lot of counseling which involves, because there's a lot of attachment of the new parents to the child as opposed to an adult. So apart from just the surgical skills, there's a lot of other overall management which is important and required in these kids. And that is one of the major differences between adult surgery and pediatric surgery. So as opposed to in adults, the adults can take care of themselves, they understand what post-operative management that we explain to them. In kids, you really cannot explain to them, even if you can in some of them, that's their nature to not follow what they are told. So the parents' responsibility in this case is a lot to take care of those patients, of their kids in the post-operative period, so that the treatment is smooth and the results are good. Yeah, so there are a lot of problems that are very specific to kids and are not found in adults, and most of them are right since birth. So we find them in newborn period. They're called congenital problems. So that's where the importance of surgery in newborns comes. So many parents are very, get scared or a little skeptical when we talk about a surgery in a newborn, 1-day-old or a 2-day-old. But there are certain conditions like diaphragmatic hernias or tracheoesophageal fistulas which are there since birth, and they have to be addressed, in a couple of days after birth also. So with the advent of recent techniques of anesthesia and the recent safe drugs of anesthesia, newborn surgery is very safe, and most of the patients can be dealt with in a very safe manner, and the results as compared to a few years before are now very good.